Yeah, hi everyone, and welcome to the Academy of Oral Surgery. This is our spring session, second day. Today we have here with us Dr. Liviu Steier. Um, Dr. Steier does not need an introduction, but I will go ahead and read some of his accolades and achievements. Uh, Dr. Steier, obviously, he is a dabble specialist. He's a specialist in endodontic and prosthodontics, and he has a vast experience in research and obviously practice in both U.S. and in Europe. Currently, Dr. Steier serves as an adjunct professor at the University of Pennsylvania Dental School in the Department of Preventive and Restorative. Uh, 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 but Dr. Steier obviously has been a clinical and course director of the Warwick University in Coventry, England, as a member of faculty of dental surgery at the Royal College of Surgeons in Edinburgh, Scotland, as a course leader, master program at the University of Manchester, England, and I can go on and on and on. Dr. Steier, it's a pleasure to have you. As a part of the bookkeeping, I'm going to go ahead and just go over some information for our listeners. Again today we had our second day of our spring virtual conference with some of the top world-class speakers. You guys make sure you use this opportunity to earn some CEs. These courses will be available offline as well, so you guys can also watch this and get CEs later on. This has been a live stream on the Global Summit Facebook pages, and also wanted to talk about 1 year free or the first year free membership of Academy of Oral Surgery. This is a great saving for all the new members. We're excited to announce that we had 500 new members just joined us last month. And this is the coupon code that you wanted to use to register at oralsurgery.org/register. Global Summit is the coupon code. And the last thing I want to talk about is the International Extraction Academy hands-on workshops, which we used to do a dozen of this around the country prior to COVID, and after COVID, obviously, all this stopped, but we're starting them back again. So, this course is obviously directed by our very own Dr. Thomas Fitterman and Dr. Carlos Morao, and these are great courses going over oral surgery techniques and also some of the complications that you'll be faced on doing your daily routine of dentistry. And this is a 50% off code that you can use for this for the enrollment, and that is AOS 2021. Dr. Steier, again, it's a pleasure to have you with us, and we're very excited to listen to your presentation.
Thank you very much. I highly appreciate the invitation. Thank you everyone for joining us. My topic is fluorescence enhanced theragnosis. So the use of fluorescence both in therapy and diagnosis. Today, the application will be oral wound care. So, sorry, I have to make a disclaimer at this stage. Yes, I own IP rights here. This is basically in the middle. You can clearly see the reveal technology. This is a special glass. These glasses have implemented filters as well as the magnification, and we have here a fluorescence technology. This is basically where we come from, and today this is the so-called fluorescence guided surgery technology with Reveal, because yes, the idea was, and like yourself, I'm coming from dentistry, but today the technology is not used as much in dentistry as it should, sadly, but it is used by neurosurgeons. The neurosurgeons use this technology for precise glioma tumor margin determination, and this technology is called Reveal FGS, so fluorescence guided surgery. The whole idea is, where I would like to take you on this lecture is open your mind, smile, and start thinking outside the box. Wound care. Okay. In wound care, fluorescence technology is one of the most important pillars. It is not only for detection of bacterial contamination, but also for therapy. So imagine all these change, the ability to clearly visually detect contamination of the wounds and addressing and treating that. We know very well that we do have these wound healing problems in the mouth. The oral cavity is a remarkable environment in which wound healing occurs in warm oral fluid containing millions of microorganisms. And we have to understand and differentiate between pathogenic and non-pathogenic ones. Many local and general factors affect oral wound healing, and an improved understanding of these factors will help to understand issues that lead to poor oral wound healing. I don't have to show you what you have never seen before. You know that it will happen in the simplest treatment as well as in the most sophisticated treatment like bone grafting and so on and so on. Wound healing is one of our enemies, and yes, it is the one which we have to face every day. Different specific oral cavity wound healing processes are, of course, listed. Healing of the palate is surely different to the periodontal healing or healing at dental implant interfaces. Dental pulp healing. Yes, I am an endodontist, and to be very honest, I would love to say that probably the best root canal treatment I would manage to perform is that one which I don't have to do. So dental pulp healing is, for me, and continues to be, a goal. Bone healing, healing of fascial burns, healing of large defects. And there are local factors to influence the wound healing as well as general factors. And wound healing in the mouth occurs in the presence, again, of many challenges, including a high bacterial and viral load. And yes, we can and have to sadly discuss in today's days about viral load as well. And I am happy to share with you in the next couple of slides some very interesting facts and information which may be able to help you in your clinical day-to-day practice. So again, the non-healing extraction socket, a diagnostic dilemma, and here we have to appreciate local and systemic factors. And among the local factors, for sure, we have to identify residual alveolar cysts, residual cysts, periodontal infection. So all in all, infection. But how can we really identify it? How can we visualize it? And this was what mainly put me in the situation that I stepped back, I sat back and I started to look for abilities and to identify technologies to come in and to support the profession and humankind in the search of visual identification of infection. I don't have to mention this healing process even following tooth extraction in orthodontic cases, even with youngsters. So the types of post-extractional healing, yes, is of course the regeneration, excessive scarring, defective repair, or the very best case scenario, the normal repair. Wound healing complications following guided bone regeneration for ridge augmentation for all the implantologists among us, and periodontists, of course. Soft tissue complications are a classic outcome. And here, this group published this paper in 2018 and proved 16.8% out of wound healing complications in GBR. So the management, yes, I'm very disturbed by this consensus report and clinical recommendation of the European Workshop in Periodontology, which was published in 2019, because, well, they discuss everything, but they do not discuss identification, visual identification and control and management of the after extraction infection. So management of peri-implant disease, this is an interesting, a very interesting paper. It shows that existing implant prognostication systems are based on studies with weak evidence, and more prospective studies with longer follow-up are required for the development of a reliable system. So what are the indications for this, for the preservation augmentation procedures based on separate clinical and radiographic extraction sockets and so on and so on? What I'm missing the point. I am missing the fact that no one is really addressing the infection, the persisting infection in the oral cavity. Why? This is my question. We know about the outcome of peri-implantitis. We know the prevalence. We know a lot, and we know also regeneration and all these. But, you know, I'm still worried, and what I'm looking for is, what do I see what do you see? What do I see on these implant surfaces? How do I know they are clean? How do I know I managed to disinfect them? So here is where I'm coming. So peri-implant disease, again, this is this paper, and yes, it is all about, again, antibiotics. Do I really need them? This is my question for you. And I am happy to share with you some information and some data proving you that no, systemic antibiotherapy is not really needed anymore today. Again, these are the step-by-step as it is done. Do I need all this invasive technology as shown here? I hope to convince you at the end of my lecture that this is not needed any further. So put your thinking mind on the head, thinking ahead, and let's start and understand. So I would like to take you to the next step. I would like to take you from a mechanistic thinking into a systemic thinking. So the wound healing process, let's understand what it is. So the wound healing process is divided in basically 4 steps: hemostasis, inflammatory phase, proliferative phase, and remodeling. How about you are empowered to what? You are empowered to visualize those 4 phases. How? Let's see. So hemostasis, in the hemostasis, we have a phase where pathogen entry is restricted. How can we guarantee that? We can guarantee that only by making sure that we really are lacking periopathogenic and karyopathogenic bacteria in that moment. Can you see that? Can you visually detect or identify that situation? Well, yes. Inflammation. How do we know inflammation is not active anymore? Can you see that? Can you identify that? Today, yes, I will show you how. So, inflammation. Do we need a process of inflammation? Yes, it is a protective response designed to rid the body of invading microorganisms. So again, let's use available technologies to make sure that we get rid of pathogenic bacteria. And we also see and identify that we manage to get rid of these bacteria. Then the next phases, the proliferation and of course the maturation, are an easy to go step. So how should we do this? So we understand that there is a lot on oral wound healing, and not only oral wound healing, especially wound healing all in all. So let's see what we have already achieved scientifically. The diagnostic accuracy of point-of-care fluorescence imaging for the detection of bacterial burden in wounds in 350 patients. The results are outstanding. Yes, this is a technology, this is a different technology, and this technology uses the very same approach, using fluorescence and to identify the bacterial load. This is from that paper showing what you can see in general healthcare in wounds, and this is what you can see and what you can identify in the mouse with the fluorescence enhanced theragnosis. You can clearly identify the presence of caries pathogenic bacteria, as well as the presence of as a leakage around the restoration, or you can identify the presence of periopathogenic bacteria. And here on these implants, on these lost implants, you can clearly see that having the technology available, you are able to, number one, identify the presence of periopathogenic bacteria, and second, you are empowered to what? You are empowered to control and monitor the process of disruption. So let's see. Oh yes, very important. Tongue. The tongue, simply the classic daylight vision compared to the fluorescence enhanced theragnosis, where you clearly can see not only so you can not only detect periopathogenic and karyopathogenic bacteria, but also fungi, here candidosis. And voila, this is a paper which has been submitted and already published. I'm grateful to the research group, to my research group from UPenn, which made this publication and this research possible. So this intraoral clinical view clearly demonstrates and identifies and empowers you to understand and to appreciate not only the presence, but only the disruption and the successful treatment outcome. So let's start with what? Let's start with visual diagnosis. And then we should continue with the visual controlled biofilm therapy. So this is kind of a step by step. So this is, as already shown to you, bacterial fluorescence imaging technology. So you clearly see the presence of bacteria, and only once you got rid from here to here, only then you will have a healing. Same in different other areas. So yes, but my question for you: let's presume you have just proceed and you have a case in front of you where you have to do whatever kind of treatment. How do you exactly know this is the right moment to start with that treatment? Have you ever thought, I would like to really visualize the lack and the disruption of biofilm? Well, yes, this is possible. This is nothing special. There are technologies, there are these live dead assays available, which we use in vitro in vitro in the laboratories, and we can use also in the mouse. We can differentiate viable and non-viable oral biofilm so that we can understand where we are at. We can use different photosensitizers. So these are called already available fluorogenic dyes. These are some of the manufacturers, as you can see, which already offer this kind of live dead assays in combination with fluorescence for the identification of complete or non-completed biofilm disruption in the oral cavity. Different solutions for disinfection, and you clearly see you still have with some of them, so green is live bacteria, red is killed bacteria. And there are even so you are using the famous golden standards here, you will still have bacteria present. So how do you know how long to continue, how long to go on with your disinfection? Simply by using fluorescence enhanced theragnosis in combination with live dead assays. This is, for example, the backlight technology. This is another live dead assay, which clearly shows you in combination with fluorescence how successful your decontamination was. And here we go to the disinfection technology. So you can use in the practice the Reveal glasses, which are manufactured by Designs for Vision. So these are, again, just to explain, these are special glasses, coated glasses in your loops. And also the magnification has a special coating to filter and cut off the emitted light. And here is a special fluorescence headlight, and this headlight will emit at a special wavelengths, and this all is so nicely constructed and built together that you can use it for the identification of pathogenic bacteria. It can be used in the mouse, and it is already used, as I said, outside the mouse. And this is the next step. This is the so-called germinator, again, fluorescence, which will support and help you in the disinfection process. Yes, this is the germinator. And the germinator, again, manufactured by Designs for Vision. It is blue light, so high energy blue light, and this high energy blue light will help you either alone or in conjunction with photosensitizers to, number one, disinfect, and number two, even help regeneration, called photobiomodulation. This is the technology using the filter. This is how it looks through. And this is a conclusion from another study. Our results suggest that fluorescence light energy is capable of enhancing collagen production, modulating cutaneous inflammation, and encouraging angiogenesis. So meaning the technology using fluorescence is not only for visualization and biofilm disruption, but it is also a heavy support for regeneration and healing. This is how you use how one uses the germinator, as I said, number one, for disinfection, and number two, for photobiomodulation, regeneration, and healing induction. Fluorescence light energy acts on mitochondrial physiology, improving wound healing. So why should we not use it in the oral cavity where we are confronted with that amount of microorganisms? And photobiomodulation describes the application of light at a wavelength ranging between 400 to 1100 nanometers to promote tissue healing, reduce inflammation, and promote also pain control. Exactly. So you are shooting with one shoot, you can kill so many birds. You can identify the presence, identify the disruption, then disinfect, and then do your or your regeneration, and even kill the patient's pain. And what will the patient most appreciate in all this? Of course, if he is painless. And yes, here is your technology to do this. So there is a lot to discuss here about regenerative medicine and photobiomodulation in wound healing. And there are many papers already published over the last years proving the application of photobiomodulation not only in the mouse but in all wounds. And yes, you may be familiar with lasers. Here you can see the laser beam. The problem with lasers for me is not every colleague, not every dentist can allow himself to invest into lasers. But every colleague, every dentist can allow himself to use what? To use LEDs, ad modum fluorescence enhanced theragnosis, for what I suggested here in this lecture. The concept of mechanism of photobiomodulation is generation of so-called reactive oxygen species, which will react rapidly, inducing potent cellular responses, intracellular photoabsorption by this so-called cytochroma C oxidase, which will disrupt the mitochondrial function, resulting in increased ATP synthesis and nitric oxide release. And like this, you have what? You are inducing a so-called photobiomodulation therapy. And this is what it is about and what you intended to do. And then, of course, photobiomics, which is a new terminology. So what is this? This is, can light, including photobiomodulation, alter the microbiome? And this has been already confirmed with research. Now, there are different ways to use the fluorescence. Either you are using the fluorescence light by itself, or one could even combine it with hydrogen peroxide. We have just submitted a research paper for publication, thanks to my research group in Passo Fundo and Professor Matteo Sousa, where we did some research. Exactly. So basically, this is hydrogen peroxide. When exposed to UV light, you clearly see what is happening. You are generating these hydroxyl radicals, which you are speeding up the process of disinfection. By the way, in cardiology, you could even treat Streptococcus mutans simply get rid of if treated for 3 minutes with this technology. So meaning the concept of drill and fill, please say goodbye and forget it. Again, this is the next generation of oral disinfection and use of the technology of the germinator in the mouse. And we are just in process of launching the next generation of the germinator with different wavelengths, which will be even more supportive for you in your daily practice. So it is the bactericidal effect of hydroxyl radical generated by photolysis of hydrogen peroxide is confirmed both for the application in Streptococcus mutans and Porphyromonas gingivalis disinfection. And this only because it is we raise the existence and the prevalence of hydroxyl radicals using this technology. The concentration of H2O2, we will be able to reduce it from the classic 3% H2O2, which you know very well has been proven to be also cytotoxic and irritant, to 1.5%. And like this, we get even better results with 1.5% in the combination with fluorescence. This has already been confirmed also by other studies and by other technologies, like proven here in this paper. The antimicrobial chemotherapy based on hydrogen peroxide photolysis, as I said, has been confirmed over the years and is not new. But the application and the combination in this way is what is new and what I wanted to share with you. So Stairways to Heaven, photolysis of hydrogen peroxide, is an effective disinfection technology in wound care, and it is proven and it is available and easy to use. So this is once again the technology, and you do not have to use the 3% hydrogen peroxide. You can dilute this to half, so 1:1, and then use it for 3 minutes and you are done. Either as a pre-treatment disinfection or post-treatment disinfection. And no, you do not need, you can slowly start getting rid of the antibiotic need and other complicated bacterial disruption technologies. So as simple as that, the patient takes some liquid in the mouth, keeps it in the mouth, and applies the technology on it, and you will get your disinfection. Again, this has been confirmed not only by our research group, but by other research groups as well. So I hope I did not bore you, and if I bored you, I would like to bring you back to this important stuff. Because listen, you are doing this sophisticated treatment every day with these surgical guides. Yes, this is a case of my own, but I cannot even think of initiating any treatment, and especially have a look, this patient surely is still contaminated in some case. Look here, this furcation defect. How can I be sure? I want to be sure. I make this treatment for this patient, and I ensure that this will be a long-lasting result. So no treatment, no really execution of a sophisticated treatment without biofilm diagnostic, without biofilm disruption and controlled success of this biofilm disruption. And of course, only under those conditions, even this PRGF application, PRGF membrane application will be successful if I manage to control bacteria in this case. And yes, the result speaks for itself. This treatment outcome is the same for the last 12 years. Another case, again, only you will manage to achieve this superb gingival outcome if you have controlled the biofilm in the mouth of the patient. And another case which needed immediate to be addressed soon and very fast. And this, you see what we did. We did first, we retreated the root canal. We retreated the root canal in this case. Then we placed first the implant here. Then we removed and disinfected and grafted the area. And we managed to achieve this result. So yes, you can simply use what is available. May have an change your thinking from a mechanistic thinking, get outside the box, and you will get satisfaction, because your patient satisfaction is only your satisfaction. So again, you can not only use the bioluminescence of fluorescence, the germinator by Designs for Vision alone, or in connection with peroxide, but you can use it even in combination with other photosensitizers as simple as curcumin, and you will have you will celebrate results. Curcumin is a component of the Indian spice turmeric. It's a type of ginger. You simply dilute it, as it has been done in this excellent study. They did what? They did they mix curcumin, dissolved curcumin, 1 gram to 1 milliliter of dimethyl sulfoxide. And then it was used in connection and in combination with fluorescence, and the antibacterial photodynamic therapy was excellent tool and achieved great success, as proven also by other papers and by other research groups as well. So overall, mouse disinfection by photodynamic therapy is the new future in clinical practice. And I think I brought you a lot of new food for thought here, and I would like to thank you very much for your attention. And yes, I am happy to listen to and to answer to your questions. So please do not hesitate, ask whatever you want.
Thank you so much, Dr. Steier. Yeah, what a wonderful and informative presentation. So this light is available now for general practitioners to buy.
Yes.
And it gets, you can use it on your, I saw it initially, you were showing a picture where it gets attached to your loops.
Not to you, please, the difference, Dr. Javid, is the following, okay? The idea is these loops, okay, which are now, the technology is called Reveal, yes? Mm-hmm. There is a special filter coating in the glasses and in the magnification. You can use the headlight, either the simple headlight, as I showed you, having just the blue light, or you can change daylight and the blue light. So you start your treatment, you perform your treatment, and then when you start doing if you do adhesive technology, you just have to change your light. Or you can use the fluorescence guided technology from start to end, and then you just have to use a wireless pedal to change the lights as you need.
Got it. I understand. Oh, perfect. And what is so do you use this throughout your procedure when you're doing this? You use that light?
Completely.
I see.
Only when I have adhesive, when I'm doing adhesive technology, okay, resins, then I have to switch off the fluorescence light. But the glasses are the same for every step. When you choose, for example, you know that when you do veneers, one of the big problems you have is to get to fit into the fluorescence of your technology, of your tools, okay, and not to let the patient, when he goes to a disco, and have these black holes, okay.
Yes,
This is again the technology to support your treatment.
I understand. And as for surgeries, you would recommend this again on the whole time or after the surgery, or?
I for surgery from scratch to the end, and you can choose if you need daylight. You can simply use the foot pedal and change to daylight. So you have all three. You have three beams here. You have daylight and two different fluorescence light, which will enhance your procedure. No tumor surgery should be performed today without the combination of photosensitizers and fluorescence guided surgery, because this is the way to perfectly identify the tumor margins. As neurosurgeons have proven today already, glioma is the top neurosurgeons today do not touch their patients without fluorescence guided surgery.
That's amazing. So, as a general dentist, we do, come across a lot of biopsies, and, we remove different lesions in the mouth, routinely in a general practice. So, what would you recommend? Is that helpful to see the margins of what we're removing?
I wouldn't ever touch without.
I see. I
And
see.
please, this for sure will be the standard of care in the future. At a certain stage, be prepared, because you understand, you very well know, and you understand that litigation is an issue around the globe. And once our friends, the lawyers, will get to know this technology, it will not be easy to justify if you do not use the technology for your treatment.
Yeah, absolutely, absolutely. I agree with you there. And I know this was obviously a very short, brief presentation. I understand you do have a more enhanced courses on this. I was trying to look. So if our audience are interested in this, they can look you up, or maybe you can share a link on the chat portion here for
The
anybody
it
who's interested.
Okay, wait, let me do. Okay, so I would suggest you simply go to this. Here you will find these are, oh, sorry. Here you can even find lectures for free of charge for you. And
Thank you. We
did it
really
come
appreciate.
through? I believe I used the wrong chat. Wait, I believe I used the wrong chat.
Let's see if we can copy it.
Okay.
Let's see. Jill, can you share? Okay, yeah, we can share that for you. That's not a
Oh,
problem at all.
fabulous. Thank
There
you.
you
Thank
go.
you. That's it.
Perfect.
Yes. And
Perfect.
here you can
Perfect.
go and log in, and it's free of charge. And you can see publications as well as, or I am I am pleased, delighted to invite you to join the Bioluminescence in Healthcare Facebook community.
Perfect. 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 And then you can maybe also just share that with us, and we can put it on the side there as well,
Yeah.
somewhere where our colleagues can join in your Facebook group. Dr. Steyer, we really appreciate you. We know that you have you're involved in many things, and we love to have you as our speaker for our Academy of Oral Surgery all the time. So we appreciate you accepting us, our invitation here. And I know it's a Sunday, you're taking the audio of basically your day off and doing this for us. We really appreciate that. Before we go, I just want to go ahead and do one more announcement on our on a couple of things again here again. Our 1 year free membership of Academy of Oral Surgery. You guys can get that using this coupon, Global Summits, at the checkout, oralsurgery.org/register. Also, last but not least, the International Extraction Academy workshops. We have a great promotion today, 50% off, and you guys can use the code AOS 2021. These are great courses, a lot of information that you can use for your daily general dentistry, even for your simple extraction, or if you wanted to learn about more complicated and just general information on basically complications and what to do if something happens. Dr. Steier, again, thank you so much. I appreciate your taking time, and have a wonderful rest of Sunday.
Thank you. Delighted. And please count on my support.
Thank you. I appreciate you very much.
Thank you very
much. Thank you, everyone, for joining us.
Bye.
And bye-bye. Thank you. Thank you, everyone, for joining us on this. This is our last session on our Spring Summit for Academy of Oral Surgery. And we have two or more of our summer and our fall sessions are coming in July and October. July, I believe that was 10 and 11, and then in October it is 6 and 7. But we will put those on for you guys on the side to be able to. We'll inform you more as they we will start signing up our new speakers, and very excited for all that. Well, thank you everyone for helping us. I appreciate you guys. Have a wonderful day.